Welcome everyone to the 14th webinar in the Governing for Reform in Aged Care webinar series. Today, our topic is around co-designing for the future of aged care. My name is Nikki Doyle, KPMG Australia's National Sector Leader for Ageing, and it is my pleasure to be your host today. I would like to start by acknowledging and paying my respects to the traditional custodians whose ancestral lands we are meeting upon today. I am on the land of the Gadigal people of the Eora Nation. We pay our respects to elders, past, present and emerging. We acknowledge the deep feelings of attachment and relationship of Aboriginal and Torres Strait Islander peoples to country. We also pay respects to the cultural authority of Aboriginal and Torres Strait Islander people attending from other areas of Australia. Today's webinar is focusing on co-design. The Australian and New Zealand School of Government, ANZOG, describes co-design as a set of processes, principles and practical tools for generating and testing new solutions to public problems by empowering people impacted by a policy issue to contribute to its solution. Within the aged care sector, it is becoming increasingly recognised that the process of co-design is fundamental to achieving consumer-centred care. It's important to emphasise that the process of co-design involves active engagement with participants to enable the design and innovation of processes and systems all the way from the idea stage through to delivery and implementation. It is widely understood that co-design has the potential to deliver wide-reaching and long-term benefits. However, due to the investment of time and attention required to do this right, organisations are often not well set up to support genuine co-design processes. Across the aged care sector, executive leaders and governing body members are being asked to consider how they can do more with less. Organisations are being faced with the challenge of navigating major reform, delivering excellent and high-quality services, while also focusing on growth and efficiency. This webinar will explore the importance of executing a deliberate approach to co-designing and aged care services with older Australians. The discussion will focus on exploring the behaviours and practical strategies that executive leaders and governing body members can implement to ensure that the principles of co-design are properly understood and the process is executed effectively to develop consumer-centred service delivery models. For today's webinar, I am delighted to be joined by Anna Donaldson, David Panther and Yvonne Miller, all of whom I am very excited to have the opportunity to talk to and learn from, but I will introduce each of them more formally shortly. Before we get started, I am conscious that while many of you joining us today have been participating in the program for some time, others are new to the program and wondering what Governing for Reform in Aged Care is all about. If you are a first-time joiner, welcome to the program. As a registered participant, if you head into the Governing for Reform in Aged Care website, you will have access to a range of different resources from the program. Some of the resources that you might like to access that are directly linked to today's webinar include the online module 1, which looks at consumers at the centre of care, 2 of our podcasts, one of which is looking at strategy and innovating for change in aged care, and the second one, which is around the role of governing bodies in designing the future of aged care. And we also have a toolkit chapter which looks at consumer and stakeholder engagement. You will also find recordings from all of our previous webinars and information about opportunities to get involved in other parts of the program. Before we dive into our panel discussion today, I would like to draw your attention to the layout of the screen. You will notice that you can manipulate the screen in any way you like. So if you'd like to see the presenters in full screen mode, you can expand the various windows to suit your preference. We'd also really like to make this an engaging discussion. If you would like to submit a question for the panel, please do so in the question and answers box on your screen. We will make sure that we leave time at the end of the event to be able to select some questions to actually go to the panel members as time allows. As I mentioned before, I have the absolute pleasure of hosting this panel discussion, looking at co-design. Please join me in welcoming our wonderful panelists for today. First of all, I would like to introduce Anna Donaldson. Anna is the founder and CEO of Lively, a not-for-profit organisation that trains and employs young job seekers, so those aged between 18 to 25 years, to provide support and connection for older community members. After starting her career in the international development sector, Anna was inspired by an experience with an isolated older woman to establish Lively, taking on the clear need for improved support and inclusion for older community members and meaningful employment for the young. What a great initiative. Her vision is an Australia in which supporting older people to live well is as mainstream as employment choice for young people, as retail and hospitality are today. And she is deeply committed to co-designing the path forward with both younger and older community members. In addition to her work at Lively, Anna has experience and qualifications in social impact measurement and analysis, public policy, research and evaluation, as well as project and operations management. Welcome, Anna. Our second panellist for today is David Panter. So originally a psychologist, David has worked in health and social care for over 43 years, half of which has been as a chief executive. In the United Kingdom, he initially worked in the National Health Service across hospital, community and primary care services, and more laterally in local government, where he was Chief Executive of Brighton and Hove City Council. In 2004, David was recruited to the South Australian Public Health System, where for over 10 years he led reforms, including the development of the new Royal Adelaide Hospital. From 2015 to 2022, David was the Chief Executive of not-for-profit aged care provider ECH in South Australia. During this time, he successfully led the transformation of the organisation away from being a provider of residential care services to being South Australia's biggest provider of affordable housing and home care services for older people. At the end of January in 2022, David became the Chief Executive at Minda, which is South Australia's largest provider of services to people living with an intellectual disability. Welcome, David. I would finally like to introduce Yvonne Miller. So Yvonne is a Professor of Design Psychology and a Director of the QUT Design Lab at Queensland University of Technology. Her research centres on design for health, and she is a co-director of the Queensland Health funded HEAL initiative, which stands for Healthcare Excellence Accelerator, and that initiative embeds designers and design doing and thinking into healthcare. Yvonne's expertise is in participatory co-design for engagement and transformation across health and aged care, and she's authored over 100 academic publications, including several books on these processes. Her most recent book, Redesigning the Unremarkable, looks at how we must redesign the often neglected elements and spaces of our built environment to enhance both human and planetary health using the lens of sustainable, salutogenic and playable design. Yvonne, welcome. And can I just say, I feel very privileged to have such three outstanding panellists joining me today. So in terms of an opening question, and I'm actually keen to get a viewpoint from each of the three of you, and I'm keen to understand that within the aged care context, what does the concept of co-design really mean? And David, I might start off with you as a practical, to get your practical insights, and then moving to Anna and then to Yvonne.
Thanks very much, Nikki. I think for me, it is very much around how you keep that focus on the people that you are here to support and provide a service to as an organisation. And within aged care, as I'm also finding now within the field of intellectual disability, that can be quite a fraught process because it involves actually identifying who that core focus person is that you're engaging with. And in aged care, it is clearly the older person themselves, but recognizing that their family or support networks will also have their own views. You just got to take something like the concept of dignity of risk, and a son or a daughter might have a very different view of what an older person should be doing compared to the older person themselves. And so that process of co-design for me has to be about how you keep the person that you are actually there for, the older person, center stage, and engage with them in a genuine process where you are prepared to live as an organization with the consequences of what comes out of that process. Because often it might be something which is actually negative in relation to what you're currently doing. You've got to be prepared to change. And if you're not prepared to change, what's the point in doing the process at all? So that focus on the person you're there for and a genuine authenticity from you as a provider organization, particularly from governing bodies who may tend to have a lower risk appetite than some, to actually go with what comes out of that process.
Fantastic. What a powerful open. Anna, over to you. What's your perspective about what does the concept of co-design really mean in aged care?
Yeah, I mean, I think David has put it so well, and I'm not sure that I can do much of a better job of describing it. But I think that, to pick up on the points that stand out most and resonate most to me, it is, really that piece around having a genuine belief, a genuine belief that older people and their family members know best what they want for themselves and their care, and seeing your role as an organisation or as a service provider as being to help realise that. And I think that, recognising that it can be challenging and fraught sometimes when you're coming from that place, I think that you can always find a way to navigate through those complexities of, the capacity of people to engage in different discussions and decisions at different times. And I think another really important piece, David talked about the fact that you have to be prepared to live with the consequences. I think that another piece in, sort of genuine co-design from my perspective is also about giving people the full context of the co-design that's going on. So really, when you are having those conversations and that open engagement with older people and their families, being really clear and upfront and explicit about what are the constraints and the limitations and the boundaries that you're working with as an organisation, helping them understand that and then together figuring out, well, how do we then manage this in the best way to work within the scope that we have and to maximise the outcomes for you. And I think through my experience, I've always been, I shouldn't be amazed, but I am always amazed by the decisions and the solutions that people will put forward and people's capacity to actually step out of sometimes their own sort of self-interest to come to a solution that's going to work for the collective when they really understand what that might look like. So, those would be a few things that I would add from my end.
Fantastic. Thank you, Anna, for those insights. Yvonne, over to you.
I agree with everything that's been said. I would add the fact that I think it's about reframing older people, aged care residents, as assets that we can work with, that, really amplifying their voices and then using those, working with those voices and the voices of staff and families to positively transform the care experience, and being very realistic, like as everyone has sort of made the point that we are working within constraints, but I think it's really important if we're going to embark on a co-design process that we're really frank. Okay, we can't co-design, we can't totally transform the mealtime experience, but what we can do is look at how we, redesign afternoon tea or redesign, what the leisure priorities are. Perhaps we don't want to sit around and, listen to music and listen to movies, and would rather put that limited budget into day trips to the beach or whatever, or a virtual reality experience. But it's about letting go of control, and that can be really challenging. That dignity of risk, I've got a number of examples of where that's gone badly and goodly. Is it even words? We could have a massive conversation about that, but it's the feeling of control, and it's being open to change, being open to go into a direction that perhaps you thought you wouldn't go, and to initiatives that you might not have thought were what were needed. But that makes it so exciting. I think it's an opportunity to really work collaboratively with your residents, with your staff, with the families, and with the local communities to transform, what your aged care offers and the experience, and really make sure that you're meeting the needs of everybody involved. So it's quite transformative, but it is also quite challenging, I think, sometimes.
Fantastic. I feel like we should dive actually straight into those challenges, because I feel that that's a really good, but that's often one of the challenges that I hear when people are talking about co-design is it's really hard. So so can I stick with you, Yvonne, put you on the spot as we start to explore some of the challenges. So what do you think are some of the main challenges and areas of focus that leaders in aged care face when they're trying to look at co-design with older Australians?
Sometimes I think we've got a little bit of fear of ceding control. We're a little bit worried about how we might actually do this. What might it look like? And I also think that we've got to be really careful that it's not a sham. It's not a sham consultation. It's not sham engagement. So, those are all fears. And so I think we've sort of talked about the fact that we need to be honest. And you can start small. You can say, okay, is anyone interested in looking at how we might, redesign our experience of leisure? Right? Who might be interested? And then engage at a scale and scope and pace and context and size that suits your organisation. So, how might you want to engage with residents with dementia? Do they need an advocate or someone to work with them and talk with them? Do you want to start, with say retirement living village or standard aged care residents? So just thinking about the logistics, and it doesn't have to be ginormous. That's the other thing. I don't want to make it like it's not a ginormous thing. It can be something as simple as, we now want to have tea and coffee out all the time. That's an outcome of the conversation we had. We talked about improving food. It's a simple change. So it can be really simple, and those simple things can be really transformative. But it is about just starting the conversation and then be willing to follow up and to implement and to look reflectively and critically at your services.
Fantastic. Anna and David, I'm conscious both of you have experience through your roles and through in your organisation. So interested from you about each of your organisations, about what some of the main challenges have been, particularly from a leadership and a governing body perspective in terms of co-design. Anna, we might start with you and then come to David.
Sure. Yeah, I would say that for us as an organisation, we haven't encountered a huge amount of challenge when it comes to sort of practicing and embedding co-design in our practice, because it's been baked into our approach from the get-go. And I think it's just a very deeply held value that this is just how we work. There is nothing that we do as far as decision-making or program design that happens without the involvement of the young and older people who are involved at Lively. And we have the luxury in that respect of being at this stage still a relatively small organisation, so acknowledging that does make it easier sometimes to do that in a meaningful way. But I think, practically through my experience of facilitating co-design processes with some of our older members, we call our clients or consumers members at Lively, I've certainly found that, in practice, some of the tools or the activities or the approaches that you might take with some groups of people might not work so well for older people as a means for them to participate really meaningfully. So by that I mean, group workshops where it's, a really sort of, dynamic, busy brainstorming sort of iterative, creative process. Some will absolutely love that and will dive in and will totally thrive. Others will find that really overwhelming, and it's quite new. They might not be used to that sort of activity or being asked to participate in that way. And it can just be, for some people, not the best forum to really get their input. So for us, it's been about sort of recognising and catering to those different needs and acknowledging that maybe sometimes it's going to be group-based work. Maybe sometimes what we need to be doing is actually going out and having one-to-one conversations with older people in their own homes about what's important to them and feeding that through and having a real commitment to and integrity in the way that we sort of hold ourselves accountable for feeding that input into the process in the right way and responding to it and feeding back to those individuals what's happened, so it's I think the challenge is, I guess, that you need to invest time, and energy and effort, but in my experience it's always rewarded by just such a better outcome for everybody. And I do think that you save time in the long run when you've got happy people for whom programs and services are working, and fewer issues emerging to deal with along the way.
Fantastic, Anna. Thanks for your perspective. David, interested in your thoughts about the main challenges and around attempting co-design with consumers.
I think for me, it is about also recognising that it's about the culture of the organisation, that you can engage in co-design as a one-off process around a particular topic or issue. But for me, it's about how does it become the core way of doing business within the organisation. And in that, recognising that the greatest asset you have as an organisation is your frontline workforce, because they are the ones that are interacting day to day, in my case at ECH, in people's homes, having those conversations. And they were the ones that were able to flag issues that potentially could turn into a co-design process to test out. So it's not just about that individual. And then how do you create the regular processes within the organisation? And for ECH, that was about creating and ceding, if you like, control and power over to a sort of member reference group that became one of the key bodies that were engaged. Also, though, being mindful that as soon as you create something like that, an organisation can often tend to stop listening to everybody else, and you end up with a group of professional consumers that are, are valuable but are disconnected from the everyday activities. So for me, it's around that culture. And I suppose the other things, and it goes to the opposite end, yes, there's a lot of co-design that can be really small-scale stuff. But equally, some of it can be really big with big consequences. And it's how you have the ability in the organisation to follow that big stuff through as well. Because whilst you might get a lot of traction and credibility as an organisation to deal with the small stuff and change what you're doing, if you aren't prepared to tackle the big stuff. And for us at ECH, that was about how we heard people saying, we want to die at home. We don't want to have to go to residential aged care to die. And that led to a whole piece of research and investigation, trying to advocate up through the reform program to get a change in the way in which home care levels were described to enable that to happen. Because we actually found we could do that, and it was less costly for the system than residential aged care. But that took a lot of mettle from the organisation to pick that issue up and advocate around that issue. So I think for me, it's about creating the culture where co-design is a way of being at every level.
Fantastic. Thank you, David. I think some great insights there. And I like the small stuff and the big stuff. I think that's really important to focus on both of those. Can I just taking a step sideways, because we are governing for reform and we are about governance, and so just interested in some initial thoughts about what is actually the role of a governing body in co-design? Like what can they do? What can't they do? What should they be doing? And Yvonne, I might come to you first, and then come back to David.
Sure. It depends how it's set up, if that makes sense. It depends what the topic is. So are you going to have a code, an initiative that's led from senior executives that's about, co-design co-designing our culture for the future? Or are you going to have some, I would perhaps lean towards something smaller to begin with, at least depending on your organizational culture. Be like, I want to, our focus this year is to redesign the nutrition food experience. That's our focus. That's our priority. We're making it our number one deliverable. Who wants to be involved in this? What might our governance look like? Who might be the representatives? What might be the steering committee look like? And what's the day-to-day actions? And then what's the budget and the deliverables and all of those things? So you can treat it like a real project. But there's slightly different in that you are engaging. And I would argue that, yes, alongside, and most of my experience is in residential aged care, so alongside older people living in care, ideally their families or the advocates, they can sometimes be hard to engage with, and it can be a really good way to help people be change agents at a really practical level. And they can be tiny things. I remember the aged care facility in Sydney, when New South Wales, they talked to people about, they felt that meal times were kind of formal, and part of the fact is that there was no tablecloths on the tables, so they put tablecloths on. That was their significant change, and it was significant. It changed the feeling and experience of mealtime at a very minimal cost. So those kind of processes can lead to small scale and large scale initiatives, and how you want to set up as an organization could be a light touch, it could be a heavier touch, but there does need to be a champion. Do you know what I mean? There needs to be a champion, and perhaps you could have a role, like an official role in your organization, that this person is the head of co-design. It depends on how you want to position it.
Fantastic. Thanks, Yvonne. David, coming to you next, and then also keen to hear from Anna on this very important topic.
I think for me, it goes with what I've previously said about the culture. The culture has to be, in part, set by the governing body. They have to support the chief exec and the rest of the organisation in developing that culture. And I'd be particularly looking to the governing body in its role around risk management, risk appetite, those types of issues, to ensure that they've thought about those things from a co-design basis. Because I've seen too many examples where there is a great proposal around how to change something, but that an organisation at the governing level gets very anxious and nervous about what going down that road might mean in terms of exposure, of risk, etc., etc. So I think it's about that culture piece and the governing body taking that on board.
And if I can respond to that directly, I agree 1,000%, but that's where a clear communication needs to come from. Okay, what is the boundaries of with which we can operate? Do you know what I mean? If we want to redesign the built environment or redesign the timing of transport, or what is the budget boundary scope? And that kind of clear communication really does set out very clearly. What is, and generally staff will have a feeling of the risk tolerance of an organisation. They'll have a sense of whether a proposal is going to fly or not, or whether it's going to need significant socialisation and engagement and communication. So I think it's a really good way to change culture, actually.
Fantastic. And Anna, can I get your thoughts about this?
Yeah, I would just add in, from my perspective, I think there's a really, really simple thing that governing body members can do, which is just adopt a standard principle or practice. Any decision that comes to you for sign-off or approval or endorsement, asking the question, who's affected by this and how were they engaged in developing this? And just asking that question. And I think, that starts to embed that culture and that way of being and that expectation that nothing goes through unless it's really clear that that's actually happened in some way. So, yeah, small, simple, but I think a really powerful thing that people can embed.
And I completely agree. What a fantastic, simple, but very effective tool that I think governing body members that are joining us today can put in their back pocket, and hopefully they can use that in terms of a lens of what they're being asked to sign off on. We have actually got a question from the audience that I might go to, because I think this is a really good one that would be timely for us to ask. So David, I'm going to come to you. First, but then we'll happily also hear from both Yvonne and Anna. So the question from the audience is, do you believe it is relevant and valuable to bring family members into this process as well as direct consumers? So David, over to you for your thoughts.
I think it's a critical part of the process, but I think it's also, as I said at the outset, making that clear distinction about who is the person that you are there for as an organisation, and what is essentially their other stakeholders, which is family, support networks, others in their life, and dealing with that balance. And I'll give you an example that I've been dealing with in my current role in intellectual disability, where we've been going through a co-design process to look at how we provide 24/7 support in people's homes to people living with intellectual disability to have their best lives. And many of those individuals we're supporting are non-verbal. And so there's an automatic assumption that it's their family, their advocates, their support networks who have that voice. And it's actually been, for us, really illuminating, recognizing those family members, but bringing them into a forum with some of our clients who do have verbal capacity and hearing what they say. And I have literally seen family members where the family member's non-verbal brought to tears because for the first time, and I'm talking about somebody who has a 50-year-old son, the first time that they'd actually thought that their son might have the same issue as one of our other clients we're supporting who are able to verbalize, because they've been so concerned about safety, protection, wanting to ensure their son is okay, not actually recognizing that they might well have their expectations, they just can't verbalize them. And for me, that's the real power of co-design, is you're actually bringing different people together. And I would say that was my same experience in aged care, bringing families who have very often strong views. Mum or dad can't do this, they shouldn't do that. They can't be put into that environment, they'll have a fall, a dreadful fall. Whereas actually you can do that in a respectful way, bringing those different voices through a co-design process. And it does change people's views. And it's important that we do that, because otherwise we will just listen to the dominant voices, and they may not be the ones that are actually the core of why we're actually here.
David, you've given me goosebumps with that example. That's what an absolutely fantastic example, but likewise, what an amazing thing to be able to have your son's voice heard and feel that it's really heard for the first time. Changing tack slightly, we have got a question from the audience as well. Keep the questions coming. There's some great questions coming through here and the question is about the establishment of some of the new requirements in terms of having a consumer advisory body that advises the board, which is part of the new legislation around governance in aged care. And Yvonne, I might come to you for your thoughts about what's your thoughts around this? Is this a catalyst for co-design? Does it replace co-design? How does this fit in with co-design?
It's a brilliant question, and you've framed it really well as well, because it's both in all of those things. I think it's an acknowledgement of the importance of the voice of the end user. All of us are in, I guess, a service delivery industry, but sometimes we forget to actually put that focus on the experience of an older person, the experience of an aged care resident, the experience of a person living with dementia. Can be easy to be focused on, I guess, numbers and other things, and just forget for a moment sometimes the lived experience and this initiatives, the requirements, and we're seeing this all over the place, whether it's mental health or aged care, to consult and to have a committee that is comprised of consumers with lived experience really is a recognition of the value. And I think it could actually really be one of the things that helps us significantly improve and transform and change, because sometimes it is the little things that make the difference, and we don't see the little things because we're so busy on the big problems that we see. And sometimes we need that lived experience to say, well, actually, what the big thing for me is I'd like to be, showered at 9 a.m. or 11 p.m., not 6 a.m. I want to change the routine, and enabling those voices to be heard through those kind of statutory bodies is really critical. It's a good thing.
Fantastic. Thanks, Yvonne. And I think reflecting on your answer and thinking about the context we're in, I think the bodies are really, really important. But I guess from my perspective, I think we've already touched upon it about, well, how do you find the ideas and how do you find where the areas might be? And I think the consumer voice that comes through that advisory body is incredibly important. But I think it's important that it doesn't replace co-design, that there is actually room for co-design that happens and must happen outside of that consumer advisory body. But that's such an important voice to be able to make sure the consumer voice is heard and is, in Anna's words, they are sitting right there beside the governing body members as they're considering those decisions. And I think they go hand in hand, and I think they're an amazing start to actually really be able to bring co-design in, and I think organisations can really use them to fast track their journey around co-design. We have another audience question as well, which is around providing some real life examples. So I think what I'm going to do, Anna, I'm going to start with you, but I'd be keen to hear from each of you. If you could almost step us through, if you're comfortable, with an example from almost from beginning to end in terms of that. How did you identify the problem? How did it work? And sharing as much as you're comfortable with. It'd be great to hear from each of you. But Anna, over to you first, if that's okay.
Yeah, sure. I've got a few examples that come to mind that I could share. I guess maybe where I'll start is an example of a process that we worked through back in 2019 at a time when Lively was then providing basically just one service that was employing young people to help older people with technology. But we had a sense that there was a much broader opportunity and that young and older people could be connecting and supporting each other in broader ways. And we had this idea that we would become a home care provider and develop and design our own home care service. And we had a bunch of ideas and hunches about how we thought that service should or could look to best meet the needs of the young and older people who would be involved. But there was a whole lot of uncertainty and unknown and assumptions flying around. And so we set out from the outset to design it and work it through together with young and older people. We put a call out in the inner north of Melbourne for a group of older people. We ended up having 13 get involved and 3 young people who fell into our sort of 18 to 25 job seeker cohort. And we worked with them really closely over a couple of months, starting with getting together as a group and talking through Lively's vision, our purpose, what we wanted to achieve, what we wanted to explore through this project, helping them really step into that and understand the why of this project, connecting all of the older people up with one of the young helpers and actually giving them a real budget that was equivalent to sort of a level 2 home care package. We had some grant funding for that, and basically getting them to simulate this service in real time with their helper and be logging what was working and what could be improved and their ideas as they came up. And then regrouping for workshops along the way to reflect on that and what was coming up and to sort of delve into some of the question areas or the challenge areas or the opportunity areas that were presenting. And then towards the end of the process, really coming back with that group and going, okay, this is what you've helped us learn. This is what you've helped us really understand. This is what we're taking from this and how we're going to move it forward and what we need to learn next. And it was just amazing the way that, you know, the participants really sort of engaged in and got involved in this process. Some of the questions that we were interested in exploring were things like, well, how do we give as much flexibility as possible to young and older people to manage the budget and the plan for their sessions together within the bounds of the legislative guidelines for a home care provider, and seeing how they really engaged with that and found really workable, sensible sort of ways of navigating that. The older people saying, hey, we don't know anything about this technology platform over here, but we can see that could be a really great tool for us to use for our budget tracking. So teach us how to use that, and we'd love to do that. And so all of these sort of possibilities that we might have perhaps sort of written off if we were just sort of sitting there imagining this working in our own minds, we were actually able to sort of lean into and bring into practice in the service itself. And we ended up with something really unique in the service model that sort of grew as a result. And the people who've then gone on to engage in that service in real life have, you know, just been so thrilled with their experience in that service, because it was sort of really tailored to them and their circumstances from the outset. So I've got another really interesting example of then sort of coming to the end, you know, 360, a point where we actually had to make a strategic decision to stop holding home care packages ourselves, and we engaged young and older people who were the actual home care package clients and helpers themselves to help us make that decision. But maybe I'll pass over to David and Yvonne, and if there's time and interest, I can speak more to that one another time or later.
Fantastic. Yvonne, we might come to you next because I'm conscious that that David will probably have an example which is around home care as well. So we might just have an example from residential aged care in between.
Okay, that sounds great. I'm going to merge a couple of different projects so that people are not identifiable. But I think one of the challenges, and I've had aged care residents say this to me, is that they're worried about seeing, and I quote, the complaining resident. Like they're the one who's always complaining that, the cup of tea is cold, and that, and so that can be one of the real challenges when you're setting up these groups, is that people fall into these roles or their categories, and they're worried that any kind of suggestion they might make be held against them. So I wanted to make that point. This to be really something to be aware of, and just to be aware of as you're setting up these groups. So many of my projects have centered around the built environment and the built form, and how we might redesign that to enhance the quality of care and the experience of care. So in lots of projects, I'll give people cameras, actually, and ask them to take photographs of highlights and lowlights and of their daily life, and then I'll do a big exhibition, and we'll be amazed and delighted about how they personalise their aged care rooms to be their own, and the things that are most important to them. And what's come out from that, little things, but other big things, knocking. Do you know what I mean? That staff are so busy that they just never knock, or they knock and go. Does it make sense? Like it's a cursory knock. It's not a real knock. So actually, really, truly seeking permission to enter someone's room. How can we change the culture and the behaviours? That was a big one. In the context of retirement villages. It was a new build, but they, on the balconies, we did an assessment. They had forgotten to, there were no taps out there for outdoor gardening, and so it was really hard to lift and move things. And then, residents did want to set up a community garden, but actually they didn't want to run it themselves because they were sick of all the politics involved with it. Like, anyone who's worked in community, and so I'm trying to give like an array of examples to talk about how, they'll identify these issues, but solving them, sometimes it's an easy thing, but sometimes it's really, really hard. So brand new pool, too cold, no wheelchair access, really hard to actually use it. And in fact, my partnership with that aged care facility, I never saw anyone in it. And in fact, residents will often point out there was nowhere for grandkids to go or families to go. And so we have to think, and they talk about, how can we activate these spaces? How can we have, community choirs and people on time, people being present, reuse and repurpose that space so that our community spaces, not just spaces for older people. And that really, I think, is the value of co-design, in that we can look at alternative uses and alternative solutions. And I'll stop talking.
Fantastic. Thanks, Yvonne. David, I'm really interested in your example. You've touched on at a high level a couple of different things from your time at both ECH and also now at Minda, but really keen to hear an end-to-end example.
Yeah, I think one I'd focus on was the development at ECH of the LGBTIQ+ specific service that was developed. It was very much in response to an emerging need, and I'm going back now sort of 6 or 7 years. And so before we saw things like the Silver Rainbow training program in aged care put forward by the department, etc., where we had identified from within our home care package clients and retirement village residents a number of people who identified with the LGBTIQ+ community and who felt very anxious about how they would be received as they potentially needed more and more services and support. And so we looked at using a co-design process to reach out into that community in order to look at how we could respond to it. And so it was a case of having identified a particular issue, but not having a solution, but seeing that that solution needed to come from the community itself if it was going to have any real benefit and value to that community. It wasn't a question of doing it to them. It had to be grown from within. And so that actually meant that we needed to have an appropriate resource, an amazing young woman, Robin, who we took on as a project manager, who was a lesbian and was already connected to elements of that community and was able to reach out further into that community and use other sort of social networks to identify people who saw this as an issue of concern, who are prepared to engage in workshops and other activities to help look at what a response might be. And so that took time, but what emerged from that was a very clear proposal about how ECH could provide a response, and a response that could be valued. But it was about how we then employed people from within that community, and we ended up with a team of part-time workers who were essentially community development workers. We had 2 men who identified as gay, 2 women as lesbian, and a transgender woman, all older people, all people using various degrees of services and support, but who wanted to be, and essentially we ended up with the LGBTI plus Connect service. And it wasn't about promoting our services or trying to sell somebody a home care package from ECH. It was generally about offering a connection. And the main focus of service delivery that came out of that in the first instance was actually about social connection and opportunities to socially connect, because one of the biggest things we've identified was the sense of isolation and loneliness amongst the older LGBTIQ+ community, who weren't the ones going to pubs and clubs and going out. They were the ones sitting at home. They'd often had, a lifetime where 2/3 of their life they'd been illegal as a gay man and lived in fear. And so,
okay, we might just, while we're trying to get David back, we might just move on to the next question, but I want to hear the end of what David is saying. David, are you still there? Are you back? No. Okay. While you're just sorting out your sound issues, what we might do is I might just go to, I've got another question that I'm really keen to ask. And Anna, we might start with you and then go to Yvonne. We have talked a lot about culture and the importance of culture, and that importance of culture from the top and from the board. So what I'm as interested in is how do executive leaders and governing body members, how should they drive, any examples about how they can actually drive the development of that culture around co-design across different services? So so Anna, if I can start with you and then go to you, Yvonne.
Yeah, the point that I made earlier about always asking that question, who's been affected, how have they been engaged, is definitely one of the ways in which I've seen our board at Lively really support the embedding of this culture in Lively as an organisation. It's always very early in the conversation when we're talking about moving in a slightly different direction or changing something that we're doing, that question comes up. What's the impact going to be? What have we heard from helpers and members about this? But I also think that there's something about being really accessible and real and authentic as humans. And one of the things that I really appreciate in the board that I'm really lucky to work with at Lively is that they're all really committed to not just being a group that sits in a boardroom every couple of months and talks about this in the abstract, but that actually gets out and engages with our young helpers, comes along to events, meets our members, and are really open to inviting those people into strategic conversations that the board is having, and being open to them hearing exactly what we're talking about, and not being, I guess, fearful of sort of managing messaging or controlling the information that people get access to. And I think that's it has such an impact across the organisation, particularly when our young and older people know that they can sit in a room together with the board members, say what's real for them in their experience of our services and what they're worried about, what they love, what they don't want to lose, what they wish they had more of, and actually see that that's being genuinely heard and listened to and responded to by those board members. So I think that, actually making that effort to connect in person with people across the organisation is such a powerful thing in terms of making it known that culture is real, and it's not tokenistic. it's not the case that, all this consultation and co-design is happening and actually then in the boardroom, it's being totally
the real decisions are made. That's right.
Exactly. Yeah. So they're probably the biggest things for my mind.
As you're talking, Anna, it made me think that I often talk about the culture of walking around, of just being visible, of being seen, of being on the open stairs, of pausing and talking to people. I think that's the most important thing that we can do. And it is hard when it's a big organization and there's lots of people and lots of sites, but that culture of being visible and actually listening, having conversations with everybody, whether it's the gardener or the cleaner or the residents, care staff, whoever it is, actually being visible and then actually translating their ideas. So having, feedback suggestion boxes and actually translating that into action, setting up working groups, really being respectful about that. I mean, it doesn't sound particularly hard, but it is hard. It is hard because we get so busy with the mechanics that we forget the importance of the people and of letting people feel that their voices are being heard. As David was talking before, and about sexuality and older people and coming out. I wrote a book about aged care, experience of aged care, and one of the residents in there, she was 80 and she came out, one of the chapters is all about secrets and sexuality. At the age of 80, she came out as a lesbian in aged care, but her challenge was, and I'll read what she said, you can't be gay in here. There's a single bed here. You can't share it. It's a one-bedroom ensuite. There's no accommodation for a couple, and we asked her, you can have sex here if you want it. I don't know. I'd like to have someone to cuddle up with, but I'm 80, I'm out now, but I haven't got anyone who I can be a partner with. So I'm gay, but I can't be gay on my own. I want somebody, but I only got a single bed. I feel like I should go back in. So, so as service providers, our challenge is to work with our residents, with our older people, and enable them to live the lives that they want, whatever that is. We have to remember that, and David made this point, and Anna as well, that co-design is about respecting the wishes of the individual and then translating those wishes into change initiatives, and delivering those in partnership. And to do that as senior executives, you need to be visible, you need to communicate, decisions that are made, and you need to be strong advocates and allies in many different sectors.
Fantastic. One extra bit to that list, that which I agree with fully, which is being really humble. I think that it's something that I think is really important for members of governing bodies to recognise, is that at the end of the day, they're actually the people with the least kind of direct connection and knowledge of what's going on in practice for people across this organisation, by virtue of the fact that they're not there day to day in the same way. And so just recognising that and seeing that, in that being the case, it is a very important role and responsibility to come in and learn and listen and be humble and sort of set aside your own sort of preconceptions or ideas of how things might be or how things should be, and just be really focused on figuring out, okay, what are people telling me is actually real right now. I think that's so important.
If we think of the TV show Undercover Boss, Undercover Boss, where the boss goes undercover for a week. I often think that it would be really good if we did that. If we went undercover even for 2 days and slept overnight in aged care, or we're undercover and actually got that lived experience. And that is what co-design gives you. If you can't do Undercover Boss and really get a sense of what the experience is like, that is actually what co-design does give you.
Mm-hmm. Fantastic. And conscious that we are, and I don't think we've got David back yet, and we are reaching towards the end. I have got one question that I was actually going to give to David because he raised it, which was around the letting go of control. And I think that was one of the things that in the opening remarks, I think all three of you touched on, about that concept of letting go of control and dignity of risk and having to balance that. So noting that I was going to give this to David, so Anna, happy to start with you, and Yvonne, for you to follow up. And if we get David back, really keen to get David's view on this before, because I think he raised it the first time. So Anna, just the concept from a board perspective and around risk, how do you balance that?
Yeah, look, I think my view is that risk is always highest when you're not in real open communication with people. And so co-design, by virtue of the fact that it requires real open communication, I actually think is a really, really powerful risk mitigation tool and strategy in its own right, rather than something that actually increases the risk that an organisation is exposed to. That would be my sort of off the hat, off the cuff rather, response. But I guess on that letting go of control, I was also reminded as you were speaking of a personal experience of this where, myself as founder and CEO of Lively and somebody with such a strong emotional connection to sort of our vision and how I see us getting there. Late last year, I mentioned a process that we worked through where we were faced with the decision about whether or not to actually continue delivering home care package services ourselves as a provider or to work purely in partnership with other organisations. And I had a really strong sense myself of what the right thing was, but I also was really committed to going through this process and being really open to what the young and older people who are part of that program and service would say, even if they said, we believe that this needs to continue, rather than winding down and passing on as I thought that we probably should strategically. And it's a really vulnerable and, sort of risky, exposed feeling that you have when you have a really strong sense of what you think is right and you're putting it in the hands of other people and being really willing to be directed by what they say. And so I think that's just inner work and personal development work that, we as sort of leaders need to sort of really lean into when we are in those spaces, so that, we're not defaulting to just trying to sort of grab back control and shape the outcomes. Yvonne, what would you add?
I love co-design as risk mitigation. That's brilliant. I just wrote that down. I'm going to steal that. That's our tagline. I agree, but I also think that when we talk about co-design, we're in there as well. Does that make sense? It's leaders as well. And so because we've got different knowledge to bring, we've got knowledge about budget constraints, we've got knowledge about other things. And so, yes, we want to authentically hear the voice of consumers and end users, and also the voice of staff and also the voice of leaders that come together. Because we want to have a financially sustainable and a socially sustainable organisation or model of care delivery. And so I think when we all come together and we respect each other's voices and perspectives, that's when the trust grows and the co-design is really risk mitigation. I love that. David, are you back with us?
I'm back. Can you hear me now?
Fantastic. Interested in two things in the time that we've got. We were just talking about that letting go of control and dignity of risk that you spoke about right at the beginning, and just interested in your thoughts about that, particularly from a board perspective. And then secondly, we desperately want to hear just the end of what you were talking about from your co-design process.
But I think that the two go together in a sense that the end of that co-design process was very much hearing from those community members from the LGBTI+ community saying, we like what you're doing, but if you're really in it, then you need to demonstrate that. And that led the organisation to go down the Rainbow Tick accreditation process, which has a cost. It also has a perception issue as well that the board had to think about and decide whether or not it wished to put itself in that position. It did. And that led all the way through, towards the end of that process, to the organisation taking a very vocal position with its service users and in the community generally around the referendum, or rather the postal vote that we had to live through with regard to marriage equality, because it was a real issue for the community that we were engaging with. And so it really did challenge the board about its risk appetite and what it was prepared to actually go with. And there were various points on the line where the board could have said, no, we've gone as far as we can go. We don't want to go any further. And that, is something we could have explained and talked about. But it was following the whole process through. And that built credibility with that community for people then to feel that, yes, we really believed it and we're authentic. So I think for me, it is, it's got to be following all the way through for that big stuff, even to achieve some of the little stuff.
Fantastic. What a fantastic example to finish on. In some ways, I'm glad we've had some challenges from a technology perspective, because I think that was a really perfect way for us to finish off today. Can I just say a very big thank you to the three of you. You have been a great panel. Your insights, what you have shared today has been absolutely fantastic. I will make note to the audience that Anna has got a co-design paper around the process that she's talked about from a home care perspective. We will put in our follow-up email to you. We'll put some information about how you might be able to access that as well. So thank you very much, panelists, for joining us today, and thank you everyone in the audience for both joining us today and for your questions. So we will be sending you an email with a link to provide feedback. Please take time to do that, because it is really valuable for us to hear you, and we're trying to adjust the experience as we progress through these webinars, and your feedback is very critical for us to do that. Please ensure that you've completed the diagnostic tool if you haven't already done so. And as I mentioned today, there are some related learning activities that you might like to also tap into after this event, including an online learning module, our first one, 2 podcasts which are listed on the screen, and our toolkit chapter around consumer and stakeholder engagement. Please make sure that you join us for our next webinar on the 19th of July, which will focus on cybersecurity in aged care. Finally, thank you very much again to our 3 panelists, and thank you very much to everyone in the audience for joining us today. I hope you enjoyed today as much as I did. Thank you.